everybody! Welcome to another episode of The Way of the Movement Professionals. My name is Maiko Morotani, and I'm a physical therapist, also a board-certified clinical specialist in orthopedic physical therapy, and I'm out here in the beautiful Los Angeles, California. I feel like I'm on a little bit of a roll as this is my second interview that I am doing this week. And today I am lucky to be sitting down with Dr. Renee Roth. She is the owner and founder of Fundamental Motion Physical Therapy and Athletic Recovery. So I hope you enjoy our conversation. And please, if you would, hit the subscribe button and like this video. And that way you don't have to worry about missing future new videos released right here at Nexus Motion. Hope you enjoy the conversation. Hey, hi Renee. Thanks for joining me this morning. How you doing?
I'm doing fine, Maiko. Thank you for having me.
Of course, of course. I've been looking forward to this conversation here, but let's start from the very beginning. I know that you have your clinical practice out in Maryland, but are you originally from the East Coast?
I am not. I grew up in the state of Michigan.
Ah, Michigan. Okay, so
Yeah.
you're a Midwest girl.
I am definitely a Midwest girl, and I grew up in a almost microscopic town of 1,800 people.
Mhm.
And so it is a very different environment living here on the East Coast and living in suburban Washington, D.C. But those were the roots in Michigan.
Did you move around from Michigan to different parts of the country or just Michigan and then to the East Coast?
Just Michigan and then the East Coast. Still in the
Yeah,
same county where I live now, almost 30 years later. I
I
guess it is
see.
30 years. I came here in 1991, so it's been a long time. Very.
And getting to the very beginning of your story, how did you first decide you wanted to be a physical therapist?
I got kind of funneled into physical therapy. It's a little bit amusing and also a little terrifying by today's standards. So I was a biology major, and my intention was to go to medical school. And I dated a man who I did eventually marry, whose entire family were doctors. His sisters were doctors, his brothers-in-law were doctors. And so I got to see firsthand what their lives were like. And it was very hectic. And I just sort of looked at that whole the level of responsibility, the inflexible time where they had a very difficult time even coordinating time off or vacation. Back in the days with beepers, every meal was interrupted by an on-call signal. So we're talking about before modern technology. And I just reflected on my choices. And then I think fate intervened because my stepfather, who lived in suburban Detroit, my mother lived in suburban Detroit, he had a shoulder injury and he was receiving physical therapy for his shoulder injury. And he said they hire college students to work in the physical therapy clinic. And why don't you, during this summer break, when I was in college, why don't you go see if they'll hire you? So I don't even know if I called first. I think I just walked in
Nice,
and said, I'm
nice.
a college student. I'm looking for a job. Do you hire college students? They hired me basically on the spot to be a physical therapy aide. And the terrifying piece of this is that we were just trained. This was in 1990, probably 1990, to do massage, ultrasound, electrical stimulation. We could set up the traction. So we would set up lumbar traction or cervical traction entirely, and the therapist would come and just push the button so the machine would begin. And I think about
Mm.
this is the cream we use for massage, and then you have someone that's there for medical treatment. You have this college student rubbing your back or rubbing your shoulder and sitting there with the ultrasound wand and just following, the instructions for or what the physical therapist wrote for intensity and duration, all of those things. But that was my first introduction to physical therapy as a profession.
I see.
And
Mhm.
then I just kind of progressed from there about thinking, where I wanted my interest in science and interest in healthcare to go. And so physical therapy then from there seemed like a good fit.
I see, I see. Wow. And so you've kind of come a long way from very modality, physical agents based, treating the symptoms kind of facility to now your clinical practice, I understand is very, very different.
Yes.
But before we get to hearing about your clinical practice, can you tell me a little bit about your expertise in like cycling? You as an athlete, but also somebody who teaches on the biomechanics of cycling.
Yes. So it's interesting parallels because when I hear Shirley talking about thinking about the movement system concept and how she would put another hot pack on and think about what she was seeing, I can relate to that in so many aspects of my life. And one place I can relate to that is my cycling history. So I used to take spinning classes, and then somebody sitting next to me in a spin class was selling a bicycle that belonged to his daughter that happened to be a custom bike that was very small. So I started road biking outside, and I would do the same route in a very well-known park here on the East Coast called Rock Creek Park in the DC metro area. I did the same route every weekend for a decade.
Wow.
And I and I enjoyed it, and you would sort of meet people, but I never really crossed paths with anybody who changed my direction. And I would see these people in large groups go by, and obviously they were leaving the park. I didn't know where they were going. And another intimidating part of this is there were no cell phones. You didn't know if this group was going to ride at your pace or your intensity. And if you were left in the countryside someplace, you had no idea where you would end up, how you would get back, what the situation would be. And then one day I ran into this man who has been very influential in my life. At a traffic light, who said, "Have you ever thought about racing?" And I said, "Yes, I've thought about racing, but I have no idea how to get into racing." And he was a member and a founding member of a racing team, which I joined and started racing. And I mean, I can't tell you how my life changed from then on, and even progressing through the racing experience. Um, was really life changing and became a huge part of my life from thereafter. And that was in
Wow.
2009, I guess.
Yeah, yeah. Wow. I am so impressed with your dedication in just that same route for like a decade.
Luckily, it's fairly a pleasant.
Uh-huh.
But yes, I know it's just odd that I would go to, short little rides in various areas, but never really felt brave enough to explore far-reaching places.
Well, I get excited about talking to another cyclist because my very first job, just during high school, was working at a bike shop, and I learned to mostly put together like the city bikes in Japan. But
Oh,
we
wow.
also got to sold a few mountain bikes or the occasional road bikes here and there. But yeah, so I have to ask you, what kind of bikes do you have? Do you have multiple? What are you riding these days?
The disease for anybody who competes with biking is bike collecting, as I'm sure anybody in the bike world, you probably have multiple bikes too, because it's just kind of like eye candy. So I have what's called an aero bike that I used for primarily criterium racing for short distances that are technical with the deeper dish wheels. And then I'm fairly small, so I can't take the crosswind resistance for the deep dish wheels when I'm, out on road rides. So then I have what's considered a climbing bike that has much smaller gears and has a less deep wheel. And it has disc brakes,
Mm-hmm.
which I I bought that bike specifically for riding in Europe because I was going to do an event in the summer. And I had heard that if you ride with rim brakes and you're descending down these huge mountains, that your rims can heat up and your tires can explode. And just the concept of that terrified me. So I
Wow.
felt that I needed disc brakes in order to do that event. So that's really become my go-to bike. And then I have a gravel specific bike for riding on. I don't have a mountain bike. What else do I have? I have an indoor bike that's just
Okay.
kind of a shell bike that has no brakes on it, but it sits on what's called a Wahoo trainer, and that's just and I even keep my shoes clipped into it, so I just hop on it, slip my feet in the shoes, and then I can ride the trainer inside when I need to. So,
That's great. That's great. I just only have two bicycles. I would love to get more, but I just don't go out riding enough. So I have my very original mountain bike that I purchased from that original bike shop that I was working at. And then I finally gave in to purchasing a road bike when my previous employer, sort of talked me into doing short distance triathlon races. And
oh
I was
wow,
race
great.
yeah, I was racing on the mountain bike with the slick tires, and it was just
Oh,
so heavy.
it's very heavy. What a different experience that road bike must have felt
Oh
like.
my gosh, it was like just cutting through the air the first time I rode it. So that's great. Yeah, outside of this interview, I'd love to like sit down and talk to you more about
Oh
bikes
yeah,
just in general. That would be fun.
I would
Um,
love that too.
Now, I'm curious about people's routines and things like that. If you have a morning routine, like what does your first hour to an hour and a half of your day look like?
So my morning routine is crazy, Maiko, and I would say probably vastly unlike anyone else you will interview for this course because I have a lot of animals.
Ooh, okay. I'm even more intrigued. Let's hear it.
So I have three indoor cats that all need to be fed, and there's kind of a treat regimen to keep one from eating food it's not supposed to. And then I have sheep, and I
Oh,
have a goat, and I have a horse. And there are also various special needs that need to be taken care of with grain soaked in the morning and additives added. And I would say my superpower is that I can get completely ready for work and dressed. I can go out to a barn with animals that aren't pristinely clean. I can clean the barn. I can come in, get in my car and drive through metro traffic and get out at my workspace and I'm perfectly clean. It's like practicing sterile technique.
wow. I cannot imagine how you do that on a daily basis, but that's quite the family you have there.
It is a busy morning and I'm not a person who allows margin for error.
Mhm.
So I everything is it's not frenetic, but everything is perfectly timed. And yesterday I had a goat that was limping. So
Oh my.
I had to address and inspect a foot and medicate it and still remain pristinely clean because I wouldn't have time to look for alternative clothes. So you never know what you're going to get, but for the most part it's fairly predictable.
I see. Wow. That is so interesting. And I thought I had a lot of animals with four cats inside and a couple
Ah,
of strays outside that
that
were
is a lot.
feeding.
It is a lot to take care of.
But yeah, no, they keep us good company and they find the comedic moments at the most interesting times.
Yeah. I know they really bring a lot to life, don't they?
Yeah. Now, do you also ride your horse quite often?
I have not ridden the horse. He was a rescue
Mm.
um that I purchased sight un I did see a video of him, but pretty much sight unseen. And when he arrived at my home, he had a lot of behavioral issues. The fun thing about that is I bought him because I discovered this trainer who's Australian who is really focused on understanding horse behavior and making sure that's the forefront principle of your approach to horses, is looking at whether they're accepting of what you're asking them to do and how they give signals if they're not accepting or ready.
Wow.
And I think the fascinating thing, Maiko, about that experience, so the thing about the horse is I pulled the horse from someone who had bought him and he was going to go to slaughter, basically.
Oh, yeah.
And I I identified this trainer, and within 6 months, that trainer who lives in California was doing a clinic on the East Coast, and I took my horse to work with him. So that was really a fun full circle, that the horse had had this doomed future and then was meeting this very, interesting and enlightened trainer. But one of the insights I've noted through focusing on horse training and relationships to the human body is that a lot of times the perspective for a horse is that it's a beast of burden, and that people have an agenda and an intention and they just want the animal to follow along with their intention. And I think a lot of times that's what our patients are looking for in their relationship to the human body, that they just want us to help the body shut up so they can do what they want to do with it, especially people who are really devoted to anything that requires repetitive activity. The activity comes first. How can I just make the body cooperate? And that's just a parallel that's given me insight into both approaches, and that the signs before symptoms approach is like your horse also showing you, if someone points out these behavioral uh, signals that tell you things aren't going the way you think that they are. And it's very similar with the human body.
Wow, wow, wow. I didn't think that the horse topic of this conversation was that's such a beautiful parallel though when you think about it. And yeah, I think ours as clinicians, our skill to be able to read the person in front of you is so important. And I guess that's what animals can teach us too, is to
Yeah.
read them. So,
Very much so. And
yeah.
and then you will get what you're looking for, but it just might be a different approach. It might take a little bit more time. It might take recognition that you're acknowledging that you hear them and what they're communicating to you versus ignoring it or trying to use some method to get them to not communicate.
Wow. Yep, yep, that's great. Now, there's a saying that you are who you surround yourself with. So I'm curious about who are some of the people who've influenced you positively in your life, and this can be either personal and or professional.
I know that you presented this question to me ahead of time, and this was really hard to put into perspective because I think we move through life with our interactions with other people and we don't necessarily reflect on their impact. Um, so many people. I had a very loving, wonderful grandfather that and grandparents that set me up so powerfully for this world of feeling loved and enjoying variety in what the world had to offer, enjoying life and animals. My grandfather got me my first pony. I was a pony crazed child, and the idea that somebody got you a pony for Christmas kind of thing was just out of this world. Um, and then my mother, who's an amazing person, she's 82, and last year we went to Borneo on a bird watching trip. She's president of a ornithological society. She moved from Michigan to Maryland, so she lives close by, and she wanted to do this Borneo trip. And for so many reasons, I admire her, but also just as a role model of thinking as we age. A lot of times the tendency is to draw back and feel like the world is a scary place, which it can be at times, but for her to get on a plane and do just beautifully, and the resilience and the interest to fly for, it was 36 hours from the hotel to our airport here in Dulles. That was amazing. And she's curious and engaged in life. So I feel like she's just a powerful role model. Um, I've had, I have to say that one of the toughest things is that the movement system folks are really my professional inspiration.
Mm.
And that Shirley Sahrmann, I discovered her book, what I would say fairly late in my physical therapy career. It was a textbook that was just part of the library of my employer, and I couldn't figure out why a patient was having a certain situation. And I just picked up that book amongst others. Um, but the fun thing about her is that I had just finished paying off my student loans for my master's degree in physical therapy. And I went to a course that was in New Jersey, and it was a packed 2-day introductory course. And I was staying at the hotel that was associated with the course. And I was eating dinner with my mouth full of a hamburger. And Shirley walked in to the hotel restaurant and was kind of looking both ways for a place to sit. And I violently was waving her over with a full mouthful of food to come and sit with me, even though, it's sort of intimidating. Here you're just attending, and here's this person who's presenting this course. I knew nothing about Shirley other than that she'd authored this book. She came and sat with me, and she said, we had a very lovely conversation, and she said, "You have to do your DPT." And I just didn't have it in me to embrace that concept until Shirley looked at me with her intense gaze and she said, "You have no choice. It's the highest level it's the highest degree in your profession, and you have to do it." So that night, I got onto the hotel Wi-Fi. And I enrolled in a transitional DPT program, and that was in November, and I started that program in January. And if it weren't for her, which I'm eternally thankful for that conversation. And that was one of those situations where you feel like the universe destined that intervention. If it weren't for her, I probably would have. And then I think at some point she said, at some point these transitional programs are going to go away because all the people who are going to do it, they weren't available when I graduated from PT school in 1999. And she said, all the people that are going to do this are going to either have done it or they're not going to do it. And so the transitional programs are going to disappear. And I'm thankful for that. And then the influence. And so I've attended courses every year since that 2012 interaction with Shirley in that introductory course. And so the trajectory and perspective of my clinical approach and the benefit for anyone, but the benefit for me and my patient population has just been exponential. So that was a powerful experience and profound. And
Wow.
then I would say the people that surround me, I have really excellent patients. I consider my patients a strong part of just my social world because of the interaction that happens in a clinical setting. I spend an hour with each patient and I get to know people. Um, and I've had some excellent friendships that have developed over the years from patient interactions. And I've, made just some amazing connections for the long term through my work.
Yeah, I love it when people include their patients as some of the folks who really influence them because I think there are some of our best teachers. I know we all have our mentors that we learn from, but patients teach us so much. So yeah, that's great. And I had no idea about your interaction and your proactiveness, just putting, getting that advice and then putting it into action right away. What an incredible story.
Yeah,
Yeah.
that's great. And I cannot, so my husband is is the dearest individual in my life and my right hand man for everything. He knows as much about the movement system as I do because he listens to me all the time. He designs my website. He's my editor. He will proofread and read through all of my slides, and he's a great person who's an interpreter between my clinical perspective and what an audience is going to perceive and hear. And he wrangles sheep. He fixes, he's my IT guy. He is absolutely a MacGyver in all ways in my life. So he's a real treasure.
Oh my goodness. Well, sounds like I hope to get to meet him one of these days. He sounds amazing. What would you do
He
without him?
I don't know. I really don't know, but he would enjoy meeting you.
Aw. Now, what is the name of your clinic and what type of patients do you see?
The name of my clinic is Fundamental Motion. And what type of patients do I see? Oh my goodness, it's just a huge range. So I do have a practicing as fundamental motion, but a fundamental velo website, which is cycling specific. And I am by no means an cycling exclusive practitioner, but even just yesterday I had a patient who brought his bike in. We put it on the trainer. I go through the movement systems exam and have a nice connection between the movement system exam and what happens on the bicycle. Um, I see a range of orthopedic complaints primarily in all age groups. I have a 17-year-old swimmer on my schedule, and I have an 88-year-old gentleman who has challenges walking, and so a broad spectrum. I do see some um, people with hypermobility, Ehlers-Danlos syndrome types of issues, and some people with POTS I have worked with in the past. So I do get referrals here and there from sources that see that population primarily.
See.
Um, but that kind of runs the gamut of general orthopedic with, a cycling relationship.
Yes, yes. And tell us where exactly is your clinic located if folks are looking to refer people to you or specific patients looking to get quality physical therapist service from you.
Sure. So I'm in North Bethesda, which is just outside of the Beltway in Montgomery County, Maryland.
Very good, very good. So folks in the DC area can also easily access your
Yes.
clinic. Hmm.
DC and Northern Virginia. I see a number of
Yeah.
patients who come from Northern Virginia because it's all part of the same metro area. So yes, I don't have a license to practice outside of Maryland, but DC and Virginia are all relatively close, and I have patients that come from those areas.
Excellent. Well, something new this year from Learn Movement System, which I think can be considered one of the best resources for movement system syndromes, is that we're doing the foundation webinar series focused on the upper quarter movement system syndromes this year, which is just in preparation before the June 2-day virtual course on the shoulder. I'm really excited that Renee is going to be teaching the final session of the Foundation webinar series. So, Renee, what can we look forward to during your lecture on May 29th?
Well, what I hope to bring is practical insights into motor learning and relate that to the model that our everyday activities create movement patterns that sometimes create injury, tissue irritation, and how to change those movement patterns and how to really, for physical therapists and for patients, how to really make that a learned experience. So how to vary practice and make it functional and bring practical uh, tips and insights and demonstrate with clinical examples how to do that in a clinical setting.
Yeah, that's right. It isn't just the end of the road isn't just like, okay, you were able to do this shoulder exercise or that, oh, you did the wall slide or the hands and knees rocking back just perfectly. It has to be related to, you know, what they're doing in real life. So this is the final punch in the preparation. I think it's a really, really important key concept that you're bringing. So looking forward to that.
I'm looking
Um,
forward to it too.
yeah. Now, kind of looking ahead to the future, if you have like 5 year or 10 year goals, would you mind sharing with us your vision for the future?
Yes, it's I have all kinds of concepts, and I guess one of the most powerful concepts, or there are two probably. One is I feel we need to have there needs to exist a hip and spine institute, which really relates what's happening in the spine, what's happening in the hip and the pelvis. And I feel that patients, and especially um, the standard medical perspective, is to look at those regions of the body in isolation. And I think that the relationships and even the medical scenario, that you have a back doctor, you have a hip doctor, and you have a physical therapist who might be following a prescription to work on the hip or work on the back, that there's a huge segment that's missing. And I feel strongly that only generating diagnosis or intervention, which oftentimes is surgery or injections or what have you, but especially surgical, is based completely on imaging of one region or the other, but nobody's appreciating the relationships. I feel very strongly about that, and also just amazed that those pieces have not been put together. Um, so conceptually, I think about does that involve a practice? Is it a consortium where there's back specialists, hip specialists, movement specialists that are convening and exchanging information, ideas? Is it a practice where these people are practicing in that scenario? And then I think the challenge, because I've witnessed some practices that have had a mission of having um, this team approach, but I've never really seen it produced very effectively, that it still seems to be these separate niches that are functioning in the same office. But I would say that that's what's driving my thoughts right now. And the other piece of it too is somehow medically the go-to source for diagnosing musculoskeletal issues is orthopedics. And just every conceptually within our culture, that orthopedics is the go-to source. And I think that stems from being able to prescribe imaging and prescribe medications. But I find there's a big disconnect, and also that I think all of us in the movement system approach are recognizing that patients are missing out on a very powerful perspective, um, that isn't just a structure or a tissue diagnosis. And I don't have the secrets to spreading that word more powerfully with a megaphone, but I just repeatedly in my clinic, it's magnified that. And what I see is, even I have hopes for younger orthopedists having different perspective, but I've received some prescriptions from orthopedists for physical therapy recently, and I don't see that that's the case. So I think we're sort of we have a big mission ahead of us, and there's plenty of change that any one of us can probably induce, either locally or on a larger scale.
Yeah, yeah. I think about this, the big picture that you mentioned, and there's so much potential that we as physical therapists can really help our communities. And then I go back to, all right, so today I have 3 patients that I'm going out to their homes and working on them, and it's just trying to influence one patient at a
Yeah.
time. And then there are other platforms, like the continuing education sort of realm, where we're trying to reach out to as many practitioners as we can in things that just are so valuable and things that just make a lot of sense. And as you said, the concept of like Hip and Back Institute, that I think the beauty of being physical therapists is that we're able to see the whole body and how they interact with one another, and not just looking at just the painful location. And that's what makes our job so fun. So I fully support your vision, and hopefully we can all work together and get louder and louder
Yeah.
to, yeah, spread such simple and yet complex concepts. I find that the more I take movement system syndromes lectures and courses, you think I should know this by now, and I know that you'll definitely resonate that I'm still taking a lot of notes because I've, you know, every time I take it, I'm a little bit more progressed clinician because I've went out and seen patients and then thought some more about it. And so it's the simplicity and yet the complexity of the kinesiopathologic model that I just can't stop learning. So
You are absolutely right. That's my experience as well.
yeah, well, this has been so fun, Renee. Thank you for sharing your insights, your past experience, where you're at, and hopefully where you're headed. And if there's anything that I can do to help support you and cheer you on, I'm right here along with you. So thank you for your time, Renee.
Thank you so much, Maiko.